Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Deformities, hunter disease in focus. Generally, it is acceptable that when we talk about deformity, you are talking of the physical appearance of a person not meeting the general population's appearance when you look at how the people generally appear. Now, when you are talking of our general appearance, it is influenced more or less is a factor of the chromosome. The chromosome is in every cell and it's in the nucleus of every cell. The DNA is also inside the chromosome. We have 46 chromosomes, 23 pairs. Now, in every chromosome, there are genes that are part and parcel of that position of the chromosome. So when you are talking of 23 pairs that and you number them one by one, every position or every point you have so many genes making up that point. Then these genes are responsible for more or less our physical appearance and other things that we usually experience. So, but when there is a genetic mutation, the gene mutates, it affects the physical appearance. And that's why majority of these deformities are as a result of chromosomal defects. It could also be point defects, that is the DNA, probably at the stage of when you are talking of a single point defect of the DNA, or even the environment. But basically, it is always chromosomal defects. And one of the chromosomal effects is the hunter disease that we have in focus. The hunter disease has a genetic defect. As a man or a boy, you have the X and Y chromosome, while female has the X and S chromosome. So the hunter disease is a problem of that sex chromosome, and you now find a situation where it is regarded as X disease problem. And when you are talking of X, the recessive gene and dominant gene are always probably pairing. At times, dominant could pair the dominant and recessive could pair recessive. But usually, the normal thing we know is that the dominant and the recessive genes usually pair together, and that is what is reflected. Now, in the situation of the hunter's disease, you'll find that the majority of those, or almost virtually all the people that have hunter disease are male, which means this X chromosome is what is transferring the disease, the X recessive gene. So where that happens, you find it almost very similar to the experience of sickness, where you want to pair them so that the experience of the baby that will come out would not be suffering from any of those diseases. But in a situation where the mother has the X, the recessive X of hunter disease, and the father also probably does not have, or he carries this as well, the child is likely going to come down with hunter disease. And that is where it is necessary for us to be educated on these issues so that we create more awareness of what is hunter disease. When you look at hunter disease, you see they have cognitive problem. And it's usually starting from age 2 to 4, the early onset. There is also adult onset, where probably in adulthood, or even from age 3 and above, it could now be showing the symptoms: stunted growth, various deformity as it appears in this photo that is being shown, and that is what we probably would not want to have as a parent. But how do you prevent it? That I shall expose in the slide session. Another question could be, what is the role of the medical laboratory scientists in this? So long as we can understand that the medical laboratory scientists have a big role to play in the sickle cell disease. The same thing in this Hunter disease. There is that urine analysis. I mean, you do the urine test or blood test to really confirm whether the person is a carrier, or probably the patient is itself having the Hunter disease experience. And the treatment is also exposed, as because it's an enzymatic problem. You just need to introduce the enzyme that is defective, that is not there, that causes the accumulation of mucopolysaccharides. Mucopolysaccharides are very important components of connective tissues. They are very useful because they serve as what would make it very flexible, even as anticoagulants, and all that I shall expose in the slide session. The outline: objective introduction, prevention, laboratory diagnosis and treatment of Hunter diseases. The objective: to create more awareness of Hunter disease, how it could be prevented, the laboratory investigations that could be done, and the latest treatment method. The introduction: Hunter disease, you could call it MPS2, mucopolysaccharidosis type 2, is an X-linked inherited genetic disorder caused by a missing enzyme that breaks down complex sugar, the mucopolysaccharides. It is caused by a mutation in the IDS gene, which is responsible for producing the iduronate 2 sulfatase enzymes. It primarily affects boys, leading to an abnormal building of this sugar, and that disorder is called mucopolysaccharidosis. In cells, as you see, every cell has that nucleus as well as the chromosomes, so as exposed in this photo, which causes severe physical changes, organ enlargement, and often cognitive decline. Symptoms usually appear between ages 2 and 4, and that is considered early onset, and ranges from mild to severe. Distinctive facial features: a prominent forehead, enlarged tongue, and flattened nose bridge, as shown in the picture. Skeletal issues: joints stiffness, claw-like hands, and short stature, as shown in the picture. Organ enlargement and enlarged liver and spleen, often with abdominal hernia. Other complications frequently: ear infection, chronic runny nose, and in severe cases, progressive neurological decline. That really affects their brain and the cognitive capacity. Now, let's talk more about this complex sugar, mucopolysaccharides, more commonly called glycosaminoglycans, GAGs, are long unbranched chains of sugar molecules found throughout the body. They are a vital structural component of connective tissues. These connective tissues are the skin, your cartilage, the bones, and they act as lubricants and shock absorber in joint fluids. So you can see their importance just all over the body. The 4 primary group includes the hyaluronic acid, which acts as a lubricant in joint fluids and skin, the chondroitin sulfate and dermatan sulfate, found abundantly in cartilage, tendon, and heart valves. The heparin we know is very useful for as anticoagulant, act as anticoagulant and play a role in cell development. Keratin sulfate found in cartilage, bone, and the cornea of the eye. So they are very important. And when this enzyme is not there, you can understand the deformity as shown in these photos that we are seeing. The prevention. Genetic counseling is what needs to be done. If the mother is a carrier, there is a 50% chance in every pregnancy of having an affected son or a carrier daughter. If the father has Hunter disease, because the disease is X-linked, he cannot pass it to his sons. All of his daughters will become carriers, but they will not have the disease. Genetic testing of the blood or saliva can identify if the mother carries the specific gene mutations responsible for Hunter disease. The prenatal testing is another way where there is natural pregnancy is already underway, and you now collect sample from the baby amniocentesis or chorionic villi samples. This can be checked if the developing baby is affected. Laboratory diagnosis. The samples collected are blood, saliva, and urine, especially when you want to do genetic testing. The diagnosis is confirmed through urine test for checking for sugar buildup in the cells. You can also collect the biopsy, and the usual staining can also show, and the enzymes assay or genetic testing. Now, finally, treatment. One thing we must know anyway is that Hunter disease is more like strictly men because it's X-linked, and it's the opposite of it is the autosomal gene effect that shows the Hurler disease. The Hurler disease can affect both male and female. As seen in this diagram, the first thing is that you see that the person is very hairy, short neck, and that is it. So for treatment, there is no cure, but symptoms are actively managed to improve the patient's quality of life. The enzyme replacement therapy, since it's an enzyme error, regular infusion of the missing enzyme, EDUCATIVE, to help break down the complex sugars. The U.S. Food and Drug Administration has granted accelerated approval to trividenofuls alpha, they also call Avia, for the treatment of neurological manifestation of Hunter syndrome. In pediatrics patient, this is a landmark development because it is the first enzyme replacement therapy designed to cross the blood-brain barrier by combining the IDS with a transferrin receptor mediated transcytosis across the blood-brain barrier. Symptom-specific care is also done where you now do surgery for the hernia or where the airways is affected, airways management or carpal tunnel syndrome, as well as physical therapy to help with joint mobility. So these are all efforts in terms of treatment that can be done. But like I said, there is no cure, but the symptoms can be managed, and treatment is for everlasting. But with these enzyme treatment, be very early for babies, at least it might be able to correct the anomaly in a way. So watch more of my video. You have many videos counting over 220 plus, and subscribe more, invite more people to watch. Thank you.